This is Rami Khoury, your current MSEP president, coming to you from Washington, D.C. at this year's Leadership and Advocacy Conference. Recently I had the pleasure to attend ED Practice Management Association, Scottsdale, Arizona, and the message from both is very clear. We have a lot of challenges with our evolving specialty. We are dealing with reimbursement threats. Out-of-network billing is top legislative agenda at both state and national levels. Advanced practice professionals are gaining more clout. Our ED colleagues are digging in their heels to stop any change or resist any movement. The term embrace change has never been more important. Our continued success is dependent on how well we embrace change. Medicine in America is evolving. Driver is the cost. And even though we know what that cost is, we need to be at the table to be a part of the solution. The solutions are win-win. APPs are part of this. Payers are part of this. The Hospital Association is part of this. CMS is part of this. And we as physicians are part of this. Would you pay 100% for a product when you can get the same product for 85%? That is effectively the APP situation and issue. That might offend some, but the reality is that is the perception out there, and that is the negotiation we are trying to deal with. And as long as we embrace that piece, we can come to a win-win solution. We have an access to care problem, and our approach has hurt us. The APP movement is out of the barn, and it is time to realize and massage the message for a win-win for all. The solution is about the greater good, and that greater good is our patient. If we stomp our feet and never come up with solutions, we will lose the fight. And that is no different than it is on any other issues like out-of-network billing, violence in emergency department, malpractice. Politics is not clean. To change our perception, improve, and solidify our future as a specialty means we have to give and play the game. This is not an option, and no one's going to change the game to something we like. If we are not at the table, then we are on the menu. Let's talk about the status quo. It is not a long-term solution. Costs are too high as a society, and we are falling behind our counterparts, which are other westernized nations, on outcomes. That is the driver. Medicare was set up as a solution for retirement, and it was meant to last 2 years, as life expectancy at the time was 67 years of age. Now, life expectancy is significantly higher, closer to 79 to 80 years of age, and that is about 15 plus years on Medicare. I would call that a fantastic success, but it is not sustainable. It has to change. We as physicians are being outfunded by hospitals, the payers, and big pharma. The average ED physician spends $27 a year on advocacy, and it is not viewed as an investment in our future. Let's stop being our own worst enemy. Imagine what we could do if we gave $100 or more each to advocacy every year. Nobody's looking out for us, and they're not looking out for our patients. Take a look in the mirror and ask yourself the following question. What do I want emergency medicine to look like in 10 years? Remember, if you don't do anything to achieve it, it will not get there on its own. Then ask yourself, what can I do to help? Ask your chapter, ask your colleagues, get involved, and learn the issues. Lastly, I would like to touch on a subject that has recently inspired me. We are leaders. Society looks to us. Get involved and do more. We have been given a privilege from society. Your degree imparts upon you certain privileges. That means you owe more. We owe more. This is an opportunity to give back to society, not just by working your shift, saving lives and going home, but taking that privilege to make the world a better place. Taking the time to do more outside of the walls of the hospital is personal wellness, professional wellness, and societal wellness. Thank you.